carers across Wales make a huge contribution to the health of the nation, but a new report published by Public Health Wales says their physical and emotional well-being is suffering because of the work they do, and the pressure is mounting. The Care Collective charity is closing with leaders saying the sector is underappreciated and underfunded. Hamish Askeri has been to meet Sylvia, an unpaid carer in Dinas Powys, to hear her story.
You can see who the champion is there.
Sylvia has an unbreakable bond with her children. Widowed when they were young, she's dedicated more than 40 years of her life to their ongoing care needs.
She really went downhill.
Her son David has severe autism, and her daughter Michelle is 95% bedbound after being struck by the disease ME at the age of just 10.
I know with Michelle, she's going to be at a level, that she needs care all the time. But with David, because of his learning difficulties, he needs 24-hour support.
Sylvia is one of more than 300,000 unpaid carers in Wales, and like so many, she's struggling to cope.
They don't realise that, you're giving medical treatment, you're responsible for somebody's health and well-being and their finances, their happiness, everything. It's like looking after a newborn baby. It's that type of responsibility.
The last census found that more than 1 in 10 of us in Wales have an unpaid caring responsibility, and yet a new study published early this month, which combined healthcare and local authority data, found that unpaid carers have worse mental and physical health than non-carers and require more support from healthcare services than the rest of the population.
Help unpaid carers in particular, but people all across Wales.
At a carers event in Cardiff, Mike and Bobby Joe are trying to meet that need. They've just started an advocacy charity which aims to raise the voices of unpaid carers across Wales.
In a recent report, it's been shown that unpaid carers save the state in Wales something like 10.8 billion a year.
Do you think that contribution is respected, is understood by the powers that be?
Not really, no. It needs to be shown. They need to show how grateful they are. They need to start taking action.
Back in Dinas Powys, Sylvia worries about getting older and what that will mean for her ability to care for her children. Her son David currently spends 1 day a week at a day centre, but Sylvia says when she asked for more support from social services early this year, she was asked to come up with an emergency care plan for when she dies.
So that when they cart me off, basically, they can ring duty social worker.
So that's it?
That's it.
The support you've received is that when you pass away, there'll be support for your children, but not before?
Basically, yeah.
How does that make you feel?
Unwanted. I know things are hard. I know there's no money around, but that's not my fault. I've been caring for over 40 years.
In a statement, Sylvia's local authority, Vale of Glamorgan Council, said, where an individual consents, we undertake a carer's assessment to understand their circumstances and provide information and support to assist them in their caring role. The council went on to say they have dedicated funding to pay for short-term care and have in the past provided respite care for Sylvia. Unpaid carers live on your road, in your town and in your village. The concern remains that if people like Sylvia across Wales become unable to care, our struggling system won't be able to cope. Hamish Askeri, ITV News, Dinas Powys.